Hello everyone, welcome back to the final session of question paper discussion public health dentistry. We are into the last and the final part, that is part 7. So this session includes research methodology and biostatistics, then the main chapter, that is ethical principles, and many short notes which includes health agencies, dental practice management and many more. So we directly start with research methodology. The question was define research, explain the steps in research methodology. So we need to define it. Then the steps in research process. So steps are almost like our survey or epidemiology. That is, it has a problem at the beginning. Then we need to conduct a review of literature. Then we need to formulate hypothesis. Then we need to prepare a design, collection of data, analysis of data, interpretation and report writing. This is very rarely asked like this, that is steps in research methodology, but once it's asked. So April 2017 the question was this. So this is almost like a bouncer. So you can very rarely expect a question like this. So you need to explain under these 7 headings. Then the next question is various methods of presentation of data. So presentation of data, it can be a tabulation method or a charts and diagrams. In tables we have master table, simple table and frequency distribution table. And charts and diagrams, we have many types: bar charts, pie diagram, line diagram, histogram, frequency polygon, pictogram, cartogram, scatter diagram. And methods of collecting data, we can collect the data from primary source, that is directly from the patient, secondary source that already collected and it is saved somewhere. From the computer we can retrieve it, or from the sites where it is uploaded, or from the records we can get, that is secondary data. And also we can conduct personal interviews, oral health examination, questionnaire. So these are some of the presentation of data: charts and diagrams, that is line graphs, we have x and y axis. This is polygraph, this is bar graph. When it is joined, that is known as histogram, and we connect the middle point of each bar in histogram is known as frequency polygon. This is box and whisker plot. It is basically to represent the interquartile range, and this Q2 is the median. Then scatter plot. Then this is pie chart. We know a pie chart. We have an example, that is our karyogram. Pictograms, things are represented using pictures. Now we are into biostatistics, the chapter that seems to be most toughest for an undergraduate student. First question, define biostatistics. Different methods of presentation of data, that already we seen. Biostatistics is nothing but branch of statistics which is concerned with data related to the biological effects. So the presentation of data we already seen. Other main question which is asked in this chapter is, I need to add this here, normal curve is also known as Gaussian distribution, and Bell's curve. It could be asked under these 3 names, it could be any name. Okay, so it can be a normal curve, Gaussian distribution because it was put forward by the scientist COHS, and Bell's curve. It looks like a bell shape. So it is a frequency distribution table. Half of the observation lies above the mean and half will be below the mean, and it is symmetrically distributed on each side of mean. So this you need to be very cautious when you write the exam, because mean is 0. Okay, mean can never be 0, but when we standardize it, the values are equal on the both sides of mean. So one side it will be positive values, that is if it is plus 1, plus 2, plus 3, because we are standardizing it. There is no individual values. We are converting it to standardized values. That is if it is 5, 10, 15, it will be 2, 3, 4. Similarly, there will be values on the left side also. That will be minus 1, minus 2, minus 3. So when we add all these standardized value, then the mean will be 0, because the values are present above the mean are almost same as values present below the mean. So it is 0. And when we make this a square, it will be a square of 1 centimeter. So the area of curve is 1. And the standard deviation is always 1. So only mean will be 0, other two is 1. And mean, median and mode will coincide. And mean plus 1 standard deviation will constitute 95.4%. That is, this color is 1 standard deviation above the mean and below the mean will be 95.4%. That means out of 1000 population, 954 people will be having a value which will be between mean minus 1 standard deviation and mean plus 1. Suppose we have example of weight. We are calculating the weight of 1000 people and mean value is 50 and standard deviation is 5. Out of this 1000 population, 954 population will be having a weight of 45 to 55. That is mean minus 1 standard deviation, that is 50 minus 1 standard deviation is 5, that is 45. Mean plus 1 standard deviation, that is 50 plus 5, that is 55. So 954 people will be having value between 45 to 55, that is weight. And 983 will be having value between 40 to 60, because 2 standard deviation below and above the mean, that is 50 minus 10, 50 plus 10. And almost 97, that is 997 participants will be having value 35 to 65. If you understood this normal curve, you need to draw this diagram, you need to write about this, you need to write the area of curve, standard deviation and mean. Now we have measures of central tendency. We have 3 things: mean, median and mode. Let's see the example. Mean is like arithmetic average. We have to sum up all these and divided by total number of observations. So x bar is a denotation, sigma x by n. We have an example here. You just randomly take some 5 numbers and do a calculation in your answer paper. You will get good marks. So add up all these values: 4 plus 3 plus 8 plus 9 plus 1 plus 7 plus 12 is 44, and number of observation 1, 2, 3, 4, 5, 6, 7. So the mean will be 6.3. Whereas median is a middle value. You see 2, 3, 4, 7, 8. So middle value is 4, because it's a odd data set. This is 6, 7, 8, 9, 9, 10. You need to arrange it in ascending order. So it is even a data set, so you need to take the middle 2 values, 8 plus 9 by 2. Okay, that is median. Mode is nothing but number which occurs most often. You have 1, 2, 1, 2, 2, 2, 1, 3, 3. Mode is 2, because 2 is getting repeated 1, 2, 3, 4 times. Here 0, 1, 2, 3, 4. No number is getting repeated, so it has no modes. Here 4, 4, 6, 7, 8, 9, 6, 9. Here 4, 6 and 9 getting repeated 2 times. So it has mode 4, 6 and 9. So these 3 are measures of central tendency. Now the dispersion. Dispersion, we have again 3 values. They are indicating how far the values are deviated from the middle values, deviated from the mean or median, how far it is deviated. We have 3 things, that is range, mean deviation and standard deviation. Range is very simple. You have to you have to arrange the values in an increasing order or ascending order, and highest minus lowest. Here 95 is the highest, lowest is a 71, and the difference is 24. That is a range. It is actually simple, but it is having no practical importance. Okay, now we have mean deviation. That is, we have to calculate the mean first, and we have to subtract all the values from the mean. So we take an example. That is the number of cappuccinos sold at the Starbucks location in Orange County, 24 to 7 people. Sample of 5 days, 20, 40, 50, 60 and 80. So take the mean, add up all these and find out the mean. So mean will be 50. So 20 plus 40 plus 50 plus 60 plus 80 divided by 5 will get 50. So you have to subtract each value from mean. So 20 minus 50. So it should be x minus x bar. So the symbol is important. So minus 30, minus 10, 0, 10, 30. Okay. If you add up all this, you will get 0. So you need to take absolute value 30, 10. Absolute value means without the symbol. So you get 80. So mean deviation is 80 by 5, that is 16. So in order to avoid this problem, what we do is we take the square root and square it. That is standard deviation. It is root mean square deviation. So it is nothing but sigma x minus x bar divided by n whole square. So there is a square root. So here it is the calculation. We need to calculate the mean. Then you have to subtract just like the mean deviation, and after that you need to square it in order to remove this negative sign. Then you have to apply it, that is x minus 1, that is 24. This is 24. Sum of squares is 24 divided by n minus 1. Total sample is 5 minus 1, 424 by 4, that is 6, and you have to take a square root, that is 2.4. So standard deviation is 2.4. Okay. Now the statistical testing. So you need to write these 6 steps for any test. It can be a t-test, it can be a chi-square test, it can be an ANOVA test. So I have uploaded many videos regarding the testing, so I'll put it in the I button. So a question which asking t-test, chi-square, f-test, you can write the 6 steps. Okay, then you can a little bit elaboration is enough for a UG level. That first you need to create a null hypothesis. Then there should be a degree of freedom. Then setting the p-value. I'm not explaining it because it is a very big concept. So you can just check out this video. I was explaining in detail. Then the test to be find of the t-value or f-value. Then the critical value table, and rejecting or accepting the null hypothesis. So commonly asked question is chi-square. It was developed by Carl Pearson when we have different set of data which is in a scale of discrete or nominal or ordinal data, or the data is in a qualitative nature, or a Likert scale, or a proportion or percentage. So t-test is given by W.S. Gossett. There are 2 types. Pair t-test, that is before after comparison, only one group where the measurement is taken before the intervention or after intervention. Whereas independent sample test, where we having group A and group B, 2 groups would be there. We take the comparison of these 2 groups, and it is the main thing is sample should be less than 30. So in all these cases you can write these 6 steps. Okay. Now we have some short notes, that is dental practice management, how to go for a selection of equipments and dental practice. It is regarding how you are going to set up your clinics, regarding the furniture, soundproofing, what is the ergonomics, separate x-ray room, autoclaving, sterilization. So general question you can write in detail. And place and locality, how the place and locality is affecting your practice, like offices, location close to offices, corporate and business houses would be an advantage. And maintenance of dental records, that is the patient's dental records, how you are going to maintain it. You need to maintain it for 5 years from the date of last dental entry. American Dental Association recommends it should be kept for an indefinite period. So mostly for a medical legal purpose it is 3 years, and the primary purpose of dental records is to deliver patient care and follow up. Okay, and it can also be used for forensic purposes. And a patient system, how the dentist should manage the patients regarding the communication and regarding the remuneration. And all these are explaining about how you should have a better practice, or how you can maintain a good practice by having a business association with a good dental laboratory, a link with a credit card manager, and you need to have a good assistant or receptionist. So all those things are very important for your practice. Now we have another question, serial extraction. So we have basically 3 methods, that is Jewell's method, Tweed's method, and Nance method. This is canine, deciduous first molar, then premolar. Here first in Tweed's, deciduous molar, then the first premolar, then the canine deciduous. Here the first deciduous molar, then first permanent premolar, and the deciduous canine. Okay, this is how you study these 3 methods together, so you won't get confused in future. That is serial extraction. Actually it is coming in Periodontics. Now we have the most important chapter, that is ethics and ethical principle and unethical practices. So ethics, the definition, it is the science of ideal human character and behavior in situations where distinction must be made between the right and wrong. There are 6 ethical principles: to do no harm, non-maleficence; to do good, beneficence; respect for persons, justice, truthfulness, and confidentiality. And there are many unethical practices, like using of bogus diploma, allowing commission without dental qualification, practicing without a qualification, displaying membership board, and using terms like tooth puller, denture maker. All are unethical practices, and we need to have a good ethics, that is not informing patients regarding the change of ownership or change of address, dentist name in dental health education pamphlet which is distributed to public. So many things which we should be very careful when we are into a practice. Now we let's look into this ethical principles. First one is to do no harm principle, that is the foundation of social morality. Iatrogenic disease is a common example that this principle they are at times people violate this principle. We should always think of the best outcome for the patient. Beneficence, or to do good, its role of dentist and dental hygiene is to benefit patients and not to inflict harm. Okay, that is treating a patient, what has to be weighed, the consequence of treatment versus no treatment. That is when we have a questionable dental caries, we need to think of what is the actual benefit for patient. And respect for person actually has 2 components. One is autonomy and informed consent. Autonomy is letting the patient to decide what exactly wants, that is autonomy. Informed consent is telling the patients about its advantages, disadvantages, alternative options, everything, and asking patients to take a decision about it. So it has got 4 attributes. It should be a voluntary one, legally competent, informed, and comprehending. They should understand it. They should be properly informed, and the person who should be able to legally competent. That is around 18 years old. And first we have to mention it properly. Secondly, the subject should understand it and sign it. The fourth principle is justice. That is, we should not show any difference respective of class, creed. So you should treat all the patients respective of which vehicle they come, which dress they wear, their color, their party, their belief, their religion. So that is justice. Truthfulness is the patient-doctor relationship is based on trust. We should be always truthful to our patients. We can't cheat our patients by giving false assurance. Confidentiality is a patient's information is very important. We should not discuss it with our friends or our relatives and other circle unless if the information regarding a procedure would help others to know about it. In those cases, you can share the information about the procedure, not the patient's personal things, because the patient would definitely open up with the doctor. So the dentist knowing many personal things about the patient, but you should never share it with your friends or colleagues. Now we have one more question, that is consent. Types of consent. We have 4 types of consent. One is implied, tacit consent, expressed, and proxy. So implied consent is nothing but when we are going for a checkup, we by default giving a consent to be checked. Okay, that is implied consent. If we are going for a blood examination, we are ready to give a blood. That is a consent. But just by going there, we automatically give a consent. That is implied consent. Tacit consent is patient comes for a treatment, okay, without being stated. Patient if is having some fever and he goes to a doctor, and doctor would give or would suggest some antibiotics or some medicines, okay, so is ready to accept the medicines. That consent. He is not actually knows much about it, but is having a problem and he wants get treatment for that. So that consent is giving, okay, to receive the treatment. Express consent, it can be oral and written. Express consent, the patient should express orally or by written. Is ready for a surgery, is ready for some procedure. Written consent can be done by his relatives. Proxy consent, when a patient is unconscious, is met with an accident, is unconscious, and he needs a surgery. So a other person can give consent because the person is unconscious, he can't give it that moment. So that is proxy consent. Now we have health organization, that is WHO. We know it was started in 7th April, headquarters at Geneva. It has got 3 components: World Health Assembly, that is Parliament, around 192 members, Executive Board 34 members, they take the actual decision, and Secretariat, it's implementation, that is section, around 8,000 members, and it has got 6 regional office, Western Pacific, USA, Eastern Mediterranean, African, so many are there, 6 regional offices. And the work is prevention and control of diseases, development of health services, and making plans for each country, family health, environmental health, statistics, biomedical research. Now we have some behavioral modification plans in Periodontics that also frequently asked. One is home, that is hand over mouth exercise, for a child who is very cranky and makes lots of problem. In the dental clinic, we can apply the hand over mouth exercise. You know how it is done. We can keep the hand over his mouth and when he cooperates, the hand can be removed. Now we have a public-private partnership. This was a short note once asked. That is most of the programs nowadays is a partnership program. That is, we take fund from public and there will be always a private investment. So that is why the stakeholders are public and private parties. So there will be definitely improvement of quality. So it can be very cost effective, high productivity, accelerated delivery, good customer focus, enhanced social services and recovery of user charges. When it is only in public sector, there will be high chance of being neglected. There won't be any accountability. So when the program where the private sector is entering, there is definitely accountability and productivity. So that is why nowadays government are always focusing on programs on a PPP manner. Now, what is monitoring and surveillance? I have done a detailed video on this. I'll put it in I button. You can just have a look. So monitoring and surveillance. Monitoring is a continuous oversight, whereas surveillance is continuous scrutiny. That is understanding the occurrence and distribution of disease, which can be done only by professionals. But this monitoring can be done by just a technician. This is just one-time activity, but surveillance is a continuous activity. And this monitoring will be stopped once the disease is eliminated, but the surveillance will be continuous, and it is a very broader concept, and there will be always feedback. But monitoring is a smaller concept without any feedback, and there will be no inbuilt action. For example, nutritional surveillance and sentinel surveillance. But this is water and noise pollution. Social norms. We are into this social anthropology, cultural anthropology, the sociology chapter. Social norms was a question asked once. It is nothing but appropriate and inappropriate values, beliefs, attitudes, and behavior. It can be explicit or implicit. So failure to stick to this rule can result in punishment. So social norm indicate the established and approved ways of doing things regarding the dress, speech, and appearance. So it can be three types: folkways, mores, and taboos. Folkways are patterns of conventional behaviors of a society. Breaking folkways does not cause much punishment, just like the gust is a god. And mores are more strictly enforced than folkways. They are shared understanding of about the kinds of behavior likely to evoke approval, disapproval, toleration, or sanction. Taboo is a different thing, that is a strong social prohibition or ban against words, objects, actions, or discussion, like abstinence from beef, pork, and smoking in Hindus, Muslims, Sikh, respectively. So breaking a taboo is considered objectionable. Okay. Some question is there. You might get a question that is lower class characteristics, that is sociology. So all are problems we face when we have patients from lower class. So to explain a little bit about one by one, that is castration complex is nothing but there is always a reluctance to be at the complete mercy of the doctor. So they have reluctance to have a general anesthesia or sedation for dental or surgical procedures. Whereas last ditch effort, these people often turn to a dentist as a last resort after all individual efforts have failed. Okay, that is last ditch effort. Now coming in crowds, these people do not like to be outnumbered by the people providing treatment. For what they do is they tend to come in crowds with family, friends to private clinical and make uneasiness for the practitioner. And contradiction of common sense, that is, some dental or medical procedures such as a continuation of a drug like antibiotics, we need to follow the course. So they don't accept that. Once the pain is over, they stop it. And if it hurts, you're a quack. And these people, they have a feeling that medical and dental treatment should be painless, and if it hurts, the practitioner does not know anything. Unclean or dirty feeling. So the cleanliness of a dental office may convey the feeling of a personal uncleanliness. Okay, this feeling can be reinforced by the dentist washing his hands after the treatment. So that is again a problem. His clinic was built there, not here. So that is since many health facilities, hospitals are located at inconvenient place for these people. So they think like this: if you really cared about us, you would have built the hospital at our place. Now they have very cold professional attitude, and they think these pills don't work, and they also think appointments are not important. And the main thing is they know teeth will be lost one day, so they don't need to care about it. Now we have contingency management, that is methods of modifying the behavior of a child by presentation or withdrawal of reinforcers, like positive reinforcer, giving a present to the child, negative reinforcer, keeping the mother out of clinic to manage the children. Mobile dental clinic, we know, we go to the rural areas and provide treatment. So always the target population will be low income families or individuals, and every mobile clinic must have 2 dental chairs, many seating capacities, audiovisual system. But the main problem, there will be high maintenance cost, difficult to access, and difficult during monsoon, and always need permission for site use. And these are the behavior management technique we already seen home. We have voice control, tell, show, do, modeling, positive reinforcer, desensitization, distraction. Tell, show, do, we need to tell the procedure, then we need to show it, then we need to demonstrate it. Okay, that is tell, show, do. Modeling is we can keep patient's siblings as a model. When he well behaved, the patient also tried to behave it that way. Palliative care is recently introduced in Kerala University of Health Science, and you would definitely get one question. So palliative care is a concept where a patient is given palliative treatment at the end of their lives, when all the medical treatment are no more a remedy. So the patient is almost nearing its death. So to improve the quality of life, the palliative care is much needed. So that question you would definitely get. It is to provide relief from pain and symptoms, offer support system to help patients actively as possible till death. So that is palliative care. And palliative medicine also I uploaded one video, you can go through it. Palliative care dentistry also, it follows the same principle. Now we have COPRA. This is the last question. COPRA is Consumer Protection Act. It was passed in 1986. It has got 3 sections. Result, that is district forum, where up to 20 lakhs can be done. Then 1 crore, that is the state commission, and national commission, that is the topper level, that is which is more than 1 crore. Here the main advantage is we don't need to keep an appointment of a lawyer. We can directly go and present our case. So Consumer Protection Act can be asked as a short note. So that was all about this session, part 7 and the last session. So we discussed the entire salvin-peter and the questions which were asked for past 7 to 10 years for the university and KUHS, that is Kerala University of Health Science. So like every time I said, it is a quick review for all the chapters and all the questions. You can prepare notes from it, and I don't recommend that because I compressed it. It is just for you to having a brief idea about each question, from which chapter it is coming and what exactly is the answer for each question, so that you can refer the textbooks or your notes by the teacher. So my aim was to guide you at the last stage of your preparation regarding the questions. Okay, so I think almost 95% of the questions I included in these 7 sessions. I'll upload it as a one session, that is complete 7 sessions. It will be around, I think, 3 hours, but it will be worth watching at the last moment of preparation. And if you are at a position where you are not having ample amount of time for detailed preparation and you just want to cross the 50% mark, I think if you spend some good time on these videos, you can just cross the 50% borderline. So I still recommend you have a good preparation on your chapters and finally come and watch all these videos, so you will get a good guidance of questions and its answers. And always write answers in a bullet points, never make it paragraph. Always include flow charts, always underline it, always write the question in one color and answer in a different color. Always make it very presentable that the evaluator can read without much difficulties. Some students' handwriting is very pathetic, so it creates a psychological hindrance for the evaluator to put good marks even though you have written it nicely. So good handwriting or good presentation would definitely improve your scores. So always prepare your answer well. Always follow the questions in the same pattern, 1 to 16. Don't shuffle the questions, and include and innovate more and more different way, so you'll get good marks. So I wish you all the best for your exams. So do well and try to write on time and keep a time for each essay question, and keep a time for your short essays and short notes. The 3 hours you can divide it accordingly by the weightage. So I'll come up with a new video or new chapters and new subject in dentistry and more. Thank you.